Hello everybody, myself Dr. Manish Kumar Jain from the Apollo Hospital, Kolkata. I am consultant nephrologist there. Today I will discuss you about the diabetic nephropathy. Because diabetes is increasing worldwide and become one of the most common epidemic, and India become capital of diabetes mellitus. Diabetic nephropathy become a most common cause of chronic renal disease worldwide. If you see in the dialysis unit, about 40 to 50% patients are suffering from the diabetes who have developed kidney disease. Diabetes in the patient who diabetes itself leads to lot of the complication, including the eye problem like diabetic retinopathy. It may lead to peripheral vascular disease. It may lead to the cardiovascular complications. Complication in the diabetes depends on the uncontrolled diabetes, duration of diabetes, and family history of diabetes present or not. Probably in the patient of diabetes, we advise to do some screening regularly. In type 1 diabetes, we advise to do urine ACR and serum creatinine every 6 monthly and eye examination once in a year. But in type of diabetes 2 patient, we advise to do urine ACR at the time of first presentation, because in type 2 diabetes, you can see renal dysfunction at the first time of presentation. If diabetes remain uncontrolled and if we not take care of this, it may lead to the very severe complication, that is the chronic kidney disease, and patient may require dialysis later on. So any patient who are suffering from diabetes should do regular screening for urine and eye examination to find their disease as early as it can be possible. One thing which I like to discuss with you, which patients should be screened regularly. The patient in which the family history of diabetes and the chronic kidney disease present, patient who have long-standing diabetes, and patient whose diabetes remain uncontrolled. Once a diabetic nephropathy can be divided into 3 groups. One is the microalbuminuria, second is the macroalbuminuria, and finally the gross renal disease. Once the disease started, we advise to do regular follow-up with the nephrologist, and we should take care of few things like control of blood pressure, control of diabetes itself, and add few medications like ACE, that is, and ARB, angiotensin receptor blockers, and the angiotensin converter enzymes inhibitors. These drugs help to prevent the progression of the diabetic nephropathy as early as it can be. But once the patient progression of disease convert to the CKD, then this patient progress regularly. Few patients may progress very rapidly and few patients gradually, and ultimately develop to ESRD. And these patients will require dialysis, and some of the patients may undergo renal transplantation. So I will like to say that when the patient of diabetes present, they should take all the precautions to prevent the diabetic nephropathy, and common of these are control of blood pressure, change in the lifestyle, there should be dietary modification, and to regular follow up their diabetologist as well as the nephrologist. Thank you.